before starting the slide presentation, I wanted to share with you, and we'll figure this out hopefully by the conclusion of the presentation, but to compare the two, before we talk about vaccines, to compare the two maps of where we were when the governor made the decision to open up things at a more significant rate and where we are today. In terms of comparison, at that time, the test positivity for the state was lower. It's now knocking on the door of 5%. Our test positivity has remained in the area of close to approximately 3. Our cases per 100,000 on March 8th was 9.33, and yesterday it was 10.55. Now, we've seen sharper increases in other parts of the state. Kent County, for one, has seen a significant increase in their cases. We've also seen an increase in cases in the Baltimore metropolitan area and in other parts of the state. That shows some increase from where we were in early March to where we are right now, both in terms of cases per 100,000 and test positivity. We have continued to receive information of new cases of variant strains within our community. We also continue to monitor, potential outbreaks in congregate situations and settings, which I'll share with at the end if I'm able to share my screen. Better way to show those maps to hammer home. Now, this shows you where we stand in terms of our cases per 100,000. We are getting fluctuating around 10 in the moderate to high risk of transmission. Again, we're not at the levels where we were earlier on in the pandemic when we reopened more broadly at the first and second phase during the summertime. Switching a little bit and pivoting to vaccinations, we now have over 25% of our population having received at least one dose. 13% of the population, county population, is fully vaccinated. And fortunately, we're seeing significant improvements, continued improvements in the percentage of those who are over the age of 75, as well as those in our 65 to 74-year-old age group having received at least one dose. Now, each of those are over 70%. And we do still have some ways to go in terms of getting folks completed through their series. This is inclusive of the Pfizer and Moderna doses, as well as any individuals who've completed with a small percentage of Johnson & Johnson and doses that we've received so far. Now, I do want to provide an update in terms of the priority groups. Yesterday, the governor's office released a memo that has directed all health, any person who is providing coronavirus vaccines to have to follow the state schedule and match up where they are. Now, that means that, as you know, we have been a little bit off in terms of the groups that we've prioritized, including all of the folks on the right in purple. Now, the governor's directive did move to those who are over the age of 60. Now, we've made provisions so that individuals who fall into that category, 60 to 65, are eligible and able to pre-register within our system so that we can get them in the queue to provide opportunities for them to be vaccinated. Now, let's be clear, however, as we've said all along, is just because someone's eligible doesn't mean you will get an appointment right away. It just adds you to the queue so that as we continue to move through those groups, you are eligible and will be able to get an appointment again as we move through the prioritization groups that way. Additionally, I think on March 30th, the next phase of the governor's vaccine plan will include individuals over the age, between the ages of 16 to 64 with pre-existing medical conditions. We will be vetting that. Unfortunately, as always, we found out on the fly yesterday. And so we will be vetting that further and providing more information out to folks in terms of the types of documentation or attestation that will be required for them to be able to get the vaccine for those who meet that criteria. This is, again, when we look at our performance compared to other counties, the number of vaccines administered, as well as on the right, the percentage of our population covered. If you recall, if you remember, Montgomery County was at the lower end of this at the early stages, given our percent population, but we continue to move forward, and now we're again have vaccinated, or at least provided at least one dose to 26% of our population, which is above the state average of 23%. This again shows you the number of doses that we've administered compared to those that have been allocated. This is inclusive of those first doses as well as second doses. We have exhausted, or will exhaust, our first doses for this week today in our remaining clinics. And our next allotment that will be coming will actually, the state did increase that this week from 6,500 to 8,000. And we will continue to staff the clinics that we have in place already. We've added an additional day with our White Oak site, as well as we are hopeful to be able to, we're completing training with a number of community providers to also be able to provide doses to them as an extension of the county operation and increase penetration through different communities. It's also important to note that we have not received confirmation of when we will get our next allotment of Johnson & Johnson doses. That could happen imminently. We thought we might get some last week, but we didn't. And so once we find out more information about that, we will certainly make that available to the general public. Now, we will be pivoting out of the high school sites beginning next week as they come back into circulation for MCPS use. We will be moving our sites to a couple of other places, including continuing to utilize our rec centers such as White Oak and East County. We will be announcing those sites shortly. And we will also be standing up the site at Germantown, Montgomery College campus in Germantown, as a county-run site consistent with how we have run our sites so far. And when we get more updates from the state related to the mass vac site, we will make those details available to the general public. This again just breaks down the percentage of doses that we've administered. And this is our breakdown by race and ethnicity, looking at the 65 and up category. We have seen a little bit of improvement from where we were a couple weeks ago. We continue to see the gap close. And then when we look at overall, regardless of age, you can see we still have a ways to go for our Black population and our Latino population, compared to the percentage of those who've actually been vaccinated, comparing it to the percent of our population breakdown. Again, our geographic representation of what that looks like. The green areas are above the Montgomery County average and the percent of 65-year-olds, 65 and up, who've been vaccinated, receiving at least one dose. And the pink and red areas are below the average of the county average in terms of that percentage who've been vaccinated. And this is the breaking it down for those who are under 65 who've been vaccinated, which would be inclusive of a host of our healthcare workers and other essential employees. Our pre-registration statistics are showing that we're seeing an increase in the 18 to 64-year-old group, which makes sense because they make up a lot of our essential employees who we're moving through, and that is the next group that will be covered in terms of vaccination, specifically 18 to 64-year-olds or 16 to 64-year-olds who are with medical conditions, but also, again, this is inclusive of our essential employees who have been prioritized within our algorithm. This shows you pre-registrations over time. We certainly need folks to continue to pre-register so that we have your information so that we can send you the link when it's your turn in the queue to get an appointment. And based upon the equity framework that has been used consistently over the last 6 to 8 weeks, here are the zip codes that remain priority tier 1 zip codes based upon the impact of COVID cases, hospitalizations, as well as COVID-related fatalities. This breaks down the demographics by age. And I will stop the share there. And the other thing that I would like to point out, and again, I'm going to work to make the maps available to give the comparison between the two, is that I did touch base with our disease control team today in terms of providing updates for cases related to our schools having gone back. They did report, we're getting a final number, that there are a lot of single cases without possible contacts in the school, which suggests home exposure. But we have had 2 outbreaks actually related to sports, interestingly. At Walt Whitman, there were at least 3 football players and 2 other football players with possible contacts. In Winston Churchill High School, we had a number of student athletes across multiple sports who were exposed to another student who attends one of our non-public schools. And we've had 2 other cases that have needed contact tracing with at least one positive case and multiple possible contacts. So we will continue to keep you updated on those as we continue to move forward. We, again, always appreciate working with our MCPS colleagues in terms of expediting that process and getting the information. I will stop there and turn the floor over to Dr. Kroll, but happy to answer any questions you all may have. Thank you.
Thank you.
So good morning, everyone. I'm going to back up to a couple of slides that Dr. Gill has presented because I wanted to go over them a little bit more in a little bit more depth with you all. And this will be quick. But one of the things that when we look at the 65 and over population, we begin to see that there is some approaching of parity, not quite where we need to be in the 65 and over population at this point, but beginning to catch up a little bit. That is, you see that in the numbers that are rising up above. Let's see, where minority residents per capita had rates that were higher than white residents did. So Black and African rates for vaccination over 65 finally began to catch up a little bit, which means we're still behind in terms of total number of vaccinations, but the numbers and the rate is picking up some. The other piece of this is that when you look across the entire county, we still see a lag. Across the entire population, we still see a lag that has to get addressed as we go forward. The other piece is that this is real progress. This is worth highlighting. This is real progress in terms of our equity distribution. This was a red and green divide up and down the 270 corridor just 6 weeks ago. And so the progress of getting folks vaccinated in our more highly impacted communities is evident when you look at the over 65. When you look at under 65, you see sort of similar kinds of patterns. We're doing a little bit better, east and west, but there's still this corridor that represents Germantown, Down County areas, Rockville, Silver Spring, that are under-vaccinated in the larger population. That will change, but as we open up to additional tiers and as more vaccine becomes available, but it is it sets the stage for our targets for where we need to be reaching out and what communities we need to be vaccinating in as we go forward. The other piece, the slide on the right, is just representing the fact that when we started this process, and looking at our communities of color in their pre-registration process, the Asian American community far and away exceeded the Black and Brown communities in terms of pre-registration. But thanks to a lot of increasing and ongoing efforts from our partners in the community, the communities are beginning to catch up in terms of pre-registration. So thank you to everybody that has worked on that to this point. I think it is it's telling, and we will begin to catch up and get there to make sure that our most vulnerable populations are vaccinated and recognized and have a chance to get access to doses. We still have pre-registration lag, obviously. We've still got a long way to go in catching up, but we are on the path, I think. And the last one, to Dr. Gill's point, we did not, after looking at the data, we did not change the hotspots. We saw some small movement in catchment areas where the case rates seem to have dropped some, but we are still we're still vaccinating and targeting and prioritizing vaccines to folks who live in the hotspot zip codes for the moment. The only other thing around the process is to Dr. Gale's point, we will continue to pre-register multiple tiers in alignment with the state prioritization. We'll begin to pre-register folks who are 60 plus, and we'll get them appointments as soon as we can move through the groups. We are also continuing to allocate by hotspots and within those zip codes by case rates within hot catchment areas or census tract areas. The other thing that is going on to try to make sure we're getting vaccines into communities that are hardest hit is that we're working with our minority health initiatives and programs and other partners to expand capacity to vaccinate and our ability to provide more mobile opportunities and geographically targeted hotspot communities. As we continue mass vaccination efforts, increasingly as doses become available, getting those doses out to our providers, to our partners, is going to help us to step up the game in hotspot communities. And then lastly, we are continuing to work with the state on its equity framework, on its equity process, and how that shows up in the county to match prospective sites that we're hearing from folks who want to host a vaccination site with vaccinators, and then to pair those two together and connect them with the state vaccination effort in the hope that they will be considered by the state as good candidates for vaccinating. We're emphasizing our hotspots and we'll give them groups that are ready to go in those hotspots as a priority to get vaccination up and running, and hopefully to draw on additional doses that are made available by the state. So that's my quick summary for today, and I'll turn it back over to you, Council President Huckner.
Thank you so much, Dr. Kroll. Dr. Stoddard or Dr. Bridgers, do you want to jump in?
I just have a couple of things I wanted to add. First off, providing an update on where we are with education vaccination rates. We've more than 26,500 offers of vaccination opportunities have been offered to Montgomery County Public Schools, staff, employees, and others, substitutes through either Johns Hopkins or the county. We believe, though we will not confirm, we're actually doing the due diligence now to confirm that we've covered everyone, but we believe this is substantially everyone. And if there are just a few stragglers, we will find them and make sure that they have opportunities, as we will also provide additional opportunities to those who did not take advantage of the first opportunity continuously. In the non-public school space, we've heard from the Archdiocese of Greater Washington, as well as the Association of Independent Schools, that they believe they're substantially covered through the Johns Hopkins partnership and did not need additional opportunities. We reached out to the additional 128 non-affiliated schools that we have contacts with as well, and have heard from a handful of those who do need some additional opportunities, and they'll be worked into the schedule this week. And before April 1st, that was our goal. And so the majority of them have also said, however, that they've been covered through the Johns Hopkins partnership or gotten vaccine opportunities through partnerships with others. And so obviously we have made really substantial progress getting our educators opportunities to be vaccinated. And as the expanded reopenings continue in Montgomery County Public Schools and elsewhere, we expect that will help reduce some of the risk associated with any potential exposures or outbreaks in those spaces. As I know many of you have noted, the governor is speaking at 2:30 today with some additional vaccine updates. We do not know what he's going to say. It's possible we could see some information and announcements come out, but we don't know exactly what's going to be said. We do continue to work, as Dr. Gale said, on the mass vaccination site, planning with the states. We have gotten great support from the National Guard and Maryland Department of Health for sharing both their expertise and other resources in how to effectively design a site like that and to build it out. But we have no additional announcements or information to say when we'll hear more. So that's all I have for that.
Okay, thank you. I have a number of colleagues who have questions for you. Let me just start off with a few. First of all, let me say, as the local council member, I'm certainly grateful for the extra day of vaccinations in White Oak. Given the governor's announcement that the state is moving to phase 2, we're already hearing confusion from residents about whether or not they are eligible. What is our plan to improve our messaging to counter the confusion among our residents?
So what I can say is, I'm not on the conference team, but I think, we found out late yesterday afternoon. So the context within we found out that the change was happening was we have a standing meeting with health officers and MDH Monday, Wednesdays, and Fridays from 1:30 to 2:30. We found out in our 1:30 meeting yesterday that the change was happening. We were told that a memo was going to be sent out and the change would be effective immediately. Once we received that, we shared it with everybody to say, here's what's happening and here's what we need to do. So I know the comms team has been working to update the county website to reflect that information. And for those of you watching at home, basically what happened was the memo said that anyone who is offering vaccines as part of the state operation or using those doses must comply with the governor's priority, the state priority level. And so I know that we have been pushing and we have been talking about anyway, moving forward and creating space for those individuals 60 to 64 and anticipating the next phase as well, 16 to 64 opportunities to pre-register and reminding them to pre-register in the system so that, again, we have their information to roll out.
Thank you. Second, given that the case numbers are on the rise across the state, what is contact tracing telling us? How much is the school opening involved as a factor in that? And what are the best steps to ensure our students as well as our staff can remain safe?
Well, we get our weekly reports from MDH related to contact tracing on Wednesdays. And so that will provide us, when we get those reports on tomorrow, provide us more information. Obviously, we can share that with you all in terms of what's happening and what's popping up. As it relates to the schools here, we anticipated that we would have cases. We have had, a number of those outbreaks that I mentioned involving a couple of clusters of cases, and we'll continue to follow that. We do, at least in the two outbreaks that I mentioned, the concern was that it was likely student-to-student transmission due to exposures through those athletic activities or other settings within that. But the other cases seem to be more frequently associated with a household contact or contact outside of the school setting.
That's good to hear. Recent information I received seems out of alignment with our Board of Health orders, is that balls are not allowed at recess for elementary schools. So I've heard from first and third graders who are incensed about this rule. I spoke to a school who said, yeah, first and third graders are more likely to put their hands in their mouth and then touch the ball. So that's why it's out of alignment with what we're allowing for high school kids. Is this really a risk?
I mean, from the literal standpoint, yes. I mean, it could carry risk because just what you mentioned in terms of, ability for control and developmentally, we can continue to work with our colleagues at MCPS to review those guidelines. Honestly, I don't know all the stipulations they have in place. But, part of it is ensuring it's the same principle of being very careful around didactics as well. Again, to minimize, contact that kids come into contact with, because younger ages are more likely to put hands in mouth, less likely to wash hands and observe a routinized level of hygiene compared, not to say the older kids will do it either, but at least, from a developmental perspective, they're more likely to do so.
Right. Okay. Thank you. That makes sense. And finally, as the local council member, I have to share with you that the Tacoma Torch, which is a highly respected and satirical journal based in Tacoma Park, is reporting today a headline that says Governor Hogan announces mass vaccination site for Montgomery County located in Ocean City during Memorial Day weekend. Have you been apprised of this and can you comment on it? Okay, you're not touching that one.
I don't. I would defer to my colleagues on that one. So.
Okay, with that, I'll turn to Council Vice President Albornoz.
Well, thank you all very much for your continued leadership. A couple of just foundational questions. We've received questions from the media and constituents on how the funding we're receiving from the federal government will be used to expand our operations around vaccine dissemination. I assume, and in my conversations, I think some of this is going to be going to contact tracing, obviously the infrastructure necessary as we expand partnerships with different community-based organizations. But could one of you just give a little bit of an overview of how we intend to spend some of the funds specific to pandemic and response and vaccine dissemination and public health?
So I suppose, I can talk a little bit about some of that. It's probably some of the answers are across all three of us. One of the things that we're doing is, as you undoubtedly know, is we're working, as we did with testing with our minority health initiatives and programs, we're working to extend some funding so that they can shift into vaccination and vaccine opportunities, as well as to identify and stand up additional providers that have not been funded to do some of that work going forward. That's a piece of the work, and we're emphasizing providers that we are working with as a matter of speed, to get them up and running and out the door in this emergency. The other piece, of course, is we are already expending funding on marketing and messaging around vaccination and vaccine hesitancy, but also just around vaccine availability. And to do that, we're working with our community partners to stand up and support the coronavirus community committees and coalitions so that they can get into the communities they need to get into. And that's the vaccine pieces of this, obviously. We are continuing to staff up and to identify staff for the department and bring them on board as necessary to do all the phases of testing and vaccination from start to finish. So as we continue to move forward, those numbers may grow as needed. As we've had to go back to schools with send a lot of our staff back to schools, we've had to shift over to contract and recruited staff that are both volunteers and in some cases paid staff to cover those costs. The other pieces, of course, as we go back to work and start having people reopen and things starting to stand up, we're working with childcare providers. We're working with our community partners to make sure that they have the resources they need. Not in all cases are we covering those costs, but where necessary, we're covering some of those costs for them to have the supplies and equipment necessary to get themselves back into business. And that's it on the human services side around vaccination. But as we talk about the Rescue Act, we are also looking at rental assistance and emergency relief and eviction prevention and homelessness as other avenues that we need to fund additional support for our community. So I'll pause there and see if Dr. Gills or Dr. Stoddard have anything else to add to that.
Yeah, I would. I know the one thing also, and I think I would invite you all to invite Mr. Hudson to talk about this as well. But I know that a lot of the comms team, there are going to be some additional dollars utilized from the vaccine opportunity to really get communications out there, utilizing different mediums, radio, television, some of the social media apps, some additional sort of content there. I know there are some ad buys that are actually in the process right now that you'll see to try and encourage people to pre-register, get vaccinated, all those things. And so I would invite you to, I don't have that full list in front of me, so I'm sure he'd be able to provide that. But the other thing I also want to make sure that, Dr. Cole touched on this a bit with, as we reopen, same is true of county operations. So for example, if we want to have camps, rec center camps over the summer, we've got to be able to extricate some of the recreational staff from supporting vaccination and testing. So we'll have to backfill them with additional contract staff. And so we know that we have to, as we recover, more things will naturally reopen, including county activities, but we can't stop doing testing and vaccination and contact tracing and all those things, the food access call center, all those other activities that we've stood up. So we're going to have to find additional staffing, likely through contracts, to support those activities while we transition county employees who have been serving in those roles very incredibly well and well trained and well operating. We've got to make sure that we can transition all those things back smoothly. And so those funds will help us to do all those things.
And the one thing I would add that we have not talked about is that as we go through this process and we come out on the other side of the pandemic, we are going to be facing a number of longer term recovery issues for both our business community, but also for residents who've been, quite frankly, traumatized by some of this experience. So we're going to have to stand up some additional mental health support and capacity for folks, and strategy, and come up with some additional and new strategies for helping the community to recover and get back on its feet, and deal with the trauma of the losses, and of, in reality, a lost year of life in some cases that people have faced this year.
That's super helpful. Just two responses to that. I know that there are, in addition to working with our minority health initiatives and program, which have been outstanding, there are also some local small minority-owned businesses that I think would make excellent partners as we expand some of the contact tracing and some of the necessary staffing to backfill some of those positions that are currently, working on helping to stand up some of our existing efforts as rec staff goes back to camps, et cetera. So I think making it clear on where to apply for those opportunities, I think, would be helpful. And on the equity issue, which obviously we've been discussing extensively at every single one of our sessions, and I appreciate the efforts of my colleagues to move forward a more discrete approach specifically within zip codes, which is what we've been doing in practice. And as we'll hear in a little bit, we're going to shift what we had initially thought we were going to do today. But I just want to stress that I think it would be helpful for us to have a more expansive discussion and strategy and rollout. We've touched on it in many different ways, and I know there's a lot of work going on through a number of different areas, but there may be some value in better explaining to the public and seeing what we need to do moving forward, particularly as the second round of federal funding becomes available, to address those equity issues and establish very clear benchmarks for what we want to hit, what we want to achieve, and how we're going to get there, which obviously we're all interested in, all support, all are on the same team to move forward. But I would like to suggest, Mr. President, that at some point we have a discussion specifically focused for an extended period of time, not just as it relates to the entire update, but more specifically how we are rolling out the equity plan. So with that, I yield back to you.
Agreed. Thank you. Yes, we'd love more detail, and I think that'll be a really great discussion. Councilmember Reamer.
Good morning. Thank you very much. Well, I wanted to make a couple of, just a general comment. Maryland, maybe it came out yesterday. It sounds like it did. The announcement about their phasing. So I think it's already been said, but today the state is going to 60 and older. On the 30th, it's going to be 16 and older with underlying medical conditions. I know, Dr. Gales, you already shared this. And then April 13th, it's the final of phase 2C, which is everyone 55 and older and essential workers. It seems to me that we would be well off to just match the state at this point, and then we could eliminate there's a little bit of confusion out there about different prioritizations. And I think we had wanted to move more slowly in the initial phase to ensure that those who are most medically vulnerable would be able to be prioritized. But now we've kind of moved through that oldest group, and we're looking at different kinds of medical vulnerabilities. And it seems to me having a broader group of people who are eligible would support our equity strategy. And at the same time, we would be able to eliminate the small confusion of there's one eligibility for the state and there's a different for the county. And then it just becomes about getting appointments. So, I guess I'd be interested in comments, but it seems to me there's a lot of upside now for us going forward to just align with the state, because they're moving fast. And they may move faster. That's the other thing. We are getting so many people statewide and countywide vaccinated on a daily basis that they're going to have to open it up pretty wide in order to sustain that pace. So it could be that the 16 and older general population happens faster than April 27th. And we wouldn't have to have an order locally to match that. So I'd be interested in comments on that. And then generally speaking, I just wanted to say, it appears to me that well over half of the people in the county who are getting vaccinated every day are getting vaccinated outside of the county, because of the mass vax sites, I think mostly, but people also are going to pharmacies around the state or even out of state. And that's not going to work in the future. We have to be able to drive vaccinations into our local communities where it may not be as easy for folks to get out and go to an appointment that's far away. So I really want to put out a call to the state to recognize that local is the future for the vaccination campaign. And they've got to shift. They've got to stop sending all new doses to the statewide sites and start sending more doses to the local communities so that our pharmacies, our hospitals, and our county clinic can actually do the programmatic work to meet the needs of the community, to get the vaccinations where they're going to be hardest to get. That's going to be the phase that's coming on us. It's coming on us faster than probably anyone at the state may understand. So I'd appreciate a comment on that. Final thing I wanted to ask about, the CDC's guidance now for schools is 3 feet of distance is sufficient for all levels of school unless they are in the highest transmission status, which the county is not in at this time. So my understanding is that the CDC guidance as applied would be that the whole school system, all grades, can be at 3 feet. I wanted to just know what our health, what expectation that the team has as far as working with schools on that. Thank you. Dr. Gales, perhaps.
Sure. Thank you, Councilmember Reamer. I will try to go through this and hopefully answer your questions. So the first question you posed or commentary related to the alignment with the state priorities. So we're required to now, the order that was sent out yesterday requires all other entities who give out vaccine to align with the state or will be penalized for that.
Okay, so that's a done deal now.
That was announced yesterday.
All right, I saw that. I didn't quite realize that's what it meant. Thank you.
Yeah, so we're required to align with it. Now, using the governor's words himself, who said, just because you're eligible doesn't mean you'll get an appointment. I want folks at home to understand is that as that eligibility increases, we have not seen the comparable increases in doses to be able to meet the needs for everyone. So there is still going to be some time to wait before you're able to get an appointment. But yes, the letter of the law, we will be aligned with the state in terms of those groups being eligible, which again is why we are encouraging folks to, if you're in those groups, to pre-register so we have your information as we continue to move through the prioritization framework. Now, the second component, I wouldn't disagree with you on that at all either, is we have asked that as the state and the federal government actually continues to promote these larger sites, that there is a comparable investment in terms of providing allotments of doses on the local level, recognizing that not everybody can utilize those sites. And there are niche opportunities to be able to address proximity, familiarity, trust, and to leverage those community level resources that people have relationships with to expand outreach, which is what we are ultimately hoping to be able to do with a windfall of doses, is to be able to stand up and support a mass vaccine, right? But also be able to continue to do the community level vaccination that we're doing now, as well as be able to support our community partners to be able to expand those efforts, both in terms of supporting them as a local health department, but also, and I will put this call out to folks as well, for private providers to make sure they register in Immunet, so that when the opportunity comes up, the state can send you doses directly to be able to share with your clinical platform and portfolio. So if you are a provider, a clinical provider in the state of Maryland, please register in Immunet if you would like to receive vaccines sent directly and shipped directly to your office or to your clinical program. And the third component related to the CDC distancing guidance is, yes, that did come out And MSDE and MDH, so the Department of Education and Department of Health, are working together to provide guidance directly to the schools moving forward on that new guidance and language. So I do anticipate that may be coming out very soon. That would take away the need to do something on a local level. And there would be state guidance for that.
Thank you, Dr. Gales.
Thank you very much. Councilmember Jawando.
Thank you. Thank you, Mr. President. And as always, thank you, Dr. Gales, Dr. Kroll, Dr. Stoddard, Dr. Bridges, and your teams for all that you do in a very, very difficult situation with poor is probably too strong of a word or nice of a word, no communication from the state about things that are moving. Just a couple of baseline questions. The 8,000 doses, I'm glad to hear that. Is that an overall increase for the county, or are those coming from other places where they were already being allotted in the county?
We think it's a little, thank you for your question, Councilmember Jawando. We think it's a shift of some of those doses from other areas coming in. For example, in looking at the allotment, for a period of weeks, MedStar Montgomery was receiving a couple of thousand doses to set up a clinic at Leisure World, and that has stopped. And so we think that the county increase in doses is absorbing some of those other doses that have previously been designated for other areas, shifting into the county to the health department allocation. And when we look across, we have seen the hospital share of doses decrease. So, well, again, we're continue to be excited to have more doses at the local health department, to be able to have some flexibility to do some of the things that we mentioned. We still have yet to see a comparable increase in the doses overall in the county to be able to sustain and match all of the new folks who are eligible.
Well, that's an important point. I'm glad, we had all said, and as I said in my first statement, I'm very happy about all the work that was described by Dr. Kroll and you about how we have already been prioritizing within the priority zip codes to the ability that we can under the current regulations. We were set today to take a bold step and to continue that work and lower the age for residents that were eligible in these priority zip codes. We have a Board of Health regulation pending that I'm going to have to withdraw in a few minutes, but we had all agreed that recognizing that if you're a Black or Latino resident that's 55 to 65, you die at a higher rate or get sicker from COVID as a white resident who's 65 to 75. And we were going to take this step, as we have since the beginning, when we were focusing on our older residents, and we stayed in 75 plus for a longer period of time, to target our equity strategy, realizing that we were the only ones doing it. The state didn't have a plan. Now they drop in and do 100 doses here and 100 doses there, and have cropped some of the work that we're doing. But now we're not going to be able to do that. So while I'm happy you're getting the extra doses, and we're going to work, you're going to bend over backwards. I know you and Dr. Kroll and Dr. Stoddard will do this. The governor has, by taking this action, has hampered our ability and taken a tool out of the toolbox to target to those who are most vulnerable. I think it's disgusting. I think it's playing politics with people's lives. It's shameful. You see in Prince George's County, when they open the mass vac site, we don't have one, and 10,000 of our residents go over there, and only 3,000 of Prince George's County residents get vaccinations, despite we know what the risks are. You have 80 residents from Montgomery County going to Salisbury to a mass vaccination site. Only 15 of them are non-white, because we know who has access to a car and who can get over there. It's not fair for anyone to have to drive that far, but we know what populations can't get out there. And so this is not just bad for Montgomery County residents, it's bad for the state. And now we've been taking another tool out of our toolbox. And again, I think it's shameful. Dr. Stoddard or Dr. Gales, I guess, were you given a reason why, inconsistent with previous orders, that now every local health department has to follow the state's pacing and prioritization? Was there a reason given for that late night change yesterday? No communication. So not only did you not know about it until yesterday, you were given no reason for it.
there was no rationale provided for the change.
Yeah, well, I think I can think of a rationale. It's called politics. And like I said, I want to be very clear. This is a disgusting step, and it's not fair to open it up to 60 plus for everybody when we don't have enough doses. You just told me they're shifting around doses. We don't have enough. I hope we do in the next 4, 6, 8, 10 weeks, but we don't right now. And you're creating an expectation that is not fair. Not only not fair to any resident, it's particularly not fair, and it's going to make us to work even harder to try to target the doses we do have to populations that are dying younger and getting sicker, in particular our Black and Brown and Latino populations. So I appreciate the work you're doing under difficult circumstances. It makes no sense that we find out about this at the 11th hour. And I think we have to do better. And I hope the governor and his team hear this. Thank you, Mr. President.
Thank you. Councilmember Friedson.
Thank you, Council President. Thank you, Dr. Gales, Dr. Kroll, Dr. Stoddard, Dr. Bridgers. Really appreciate all of your efforts, and particularly excited to hear some of the progress being made. The fact that every educator in MCPS has received the opportunity to be vaccinated, and the vast majority of non-public school teachers. I mean, that is significant progress from where we were just a few weeks ago. And so thank you to your teams and the coordination with the school system and the non-public schools and Johns Hopkins. That is really positive. Related to that, now that the Johns Hopkins, which that was a serious part of their strategy, was to focus on that particular population, given its importance, which I think was a real positive, and they work closely with you, which I think we all appreciate. Is there any thought to change that priority, perhaps to childcare, which is also classified by the state as the education sector, to have, are there any conversations to have a similar partnership with Johns Hopkins Medicine with their doses to really focus and have a coordinated effort beyond the 100 that I know have been dedicated to childcare personnel?
Thank you, Councilmember Friedson, for the question. We actually have, over the last multiple weeks, been sending out with links to register and get appointments for childcare providers beyond the 100 that we had allocated, because the allotment to Hopkins actually has decreased as well, so they're not getting the same amount. So starting, I want to say 3 to 4 weeks ago, we've been including childcare staff in our clinics. And so I don't have the nice, clean statistics that Dr. Stoddard presented in terms of the number who have provided, but we have been prioritizing and working through that group steadily over the last several weeks.
I really appreciate that. Sorry, Dr. Stoddard.
Yeah, I was going to say, I saw a message last night from that we have a team that's working on these tier 2, we call them tier 2, tier 3 team, which is everyone, the essential workers in 1B, tiers 2 and 2, tier 3 that we are focused on, including the childcare workers. Mm-hmm. And I do know that, and this includes grocery store, manufacturing, and others. I do know that everyone who is currently pre-registered as one of those categories has received an invitation to be vaccinated. Now, that doesn't mean that every childcare worker, because we know that there are childcare workers who have not pre-registered that we need to get into our system, but everyone in the system so far has received at least one opportunity and will receive additional opportunities over the coming days. I saw a message sent out midnight last night about another opportunity for essential workers to be vaccinated. And so, as Dr. Gales alluded to, we are making substantial progress through this group. Obviously, there isn't like a single way to track all the childcare workers. There isn't like a single institution to track all the childcare workers, particularly those that are part of that informal economy that we've talked about before, who aren't registered childcare workers. And so we're going to do some more, sort of due diligence to see where exactly we are and who needs the limitations. But I suffice it to say, Dr. Gales is absolutely correct. We've made much more substantial progress than a couple thousand through that group, just through the opportunities through the pre-registered list.
I really appreciate that, and the fact that every
sorry, I was going to add to that,
please.
That our Office of Education, our Early Child Care and Education Office, is working with the known child care providers to make sure that we continue to message them to get their staff in. So we're continuously outreaching, even though the list has been gone through for the first time. We'll go back through the list, but also do more outreach, continue to do outreach to the providers that are licensed providers in the county to get them to register and to pre-register for a vaccine.
I appreciate that. That's news that everybody who had pre-registered in that category has been offered a vaccine appointment. That's significant. If there's any way, I know it's much harder with this than it is with MCPS, for instance, but to have a number of the anticipated number of childcare personnel and then to kind of check our progress each week, I think that would be really helpful. I think it's one of the reasons why the educators went so significantly was that there was a goal, there was a number, there was a date, and then you did tremendous work in order to get there. I know how hard you and your team had to work together with partners in order to make that happen. Okay, just switching gears quickly from that. On the homebound question, I continue to be concerned, and I know you are as well, as we move to the additional categories. The older residents, as you have aptly stated before, are 4 times more likely, 80 and over, to have the worst outcomes as we talk about our equity strategy. Focusing on the data and the older residents, I know has been part of that as well. Also, in addition to the racial and zip code focus, which is an important focus. For homebound residents, I know you have been working on these pilot programs. Given the additional vaccines we're receiving this week, is there any thought to expanding that pilot program? And could you just give us an update on that? I know you're also working with partners in the community to try to do this outreach, since it's different than other vaccination appointments. But if you could update us on any plans for expansion of the pilot and how you're working with those community partners, I'd appreciate it.
Sure. So we're actually not going to focus on just one particular provider for that. We are creating a network of providers to be able to support those efforts, recognizing they have different footprints in the community. So we're meeting with one of those pilot folks today to actually review how that has gone so far and things we need to change and tweak with that so that it is successful moving forward. And we also exploring other options as well to be able to chip away at that homebound group. What I will say is, in the absence of specifics of those, as we continue to work through the details, is that as the allotments increase, we will have dedicated doses set aside to provide to those groups. So for the folks who do fit into that category, I don't want you to feel that as we add more people to it, doses will shift there. And the strategies that we have in terms of making those announcements about where doses go to support those clinics, we will keep a dedicated stash, if you will, for those homebound efforts to make sure that those seniors or any other individual, regardless of their age, still have access to the vaccine, even as we continue to move through and add others to the prioritization groups.
That's great. And in terms of communicating with those folks, those who are 75 and older who checked off homebound when they pre-registered, if there's still confusion on how they'll find out about appointments, and so if there's clarity on the email address they should be looking for or the phone number that they might get a call or a text from, if you can share that with us and allow us to make sure we're communicating that to them. As we work with different partners, that's positive because it allows us to reach more people, but not having uniformity also makes it a bit confusing for those who may not be totally technologically savvy. So if there's a way to create some uniformity, obviously some of this is out of our control based on the process from the state and beyond, but that which is within our control, if it's possible to do that, that's great. Before turning it over to colleagues, I just appreciated the comments by Dr. Kroll about the mental health challenges. I think we're going to have broad community and then individual post-traumatic stress from this past year and the amount of trauma that so many have faced. And we need a strategy for that. And it's going to have to be all hands on deck, and all of us are going to have to be included. So really appreciate you lifting that up. And I know all of us want to be a part of that to support you in that. And then in terms of the staffing changes, both on the mental health aspect and on the different activities, do we have a timeline for just a plan for what those contracting staffing needs are going to look like as we head towards the late spring and summer months, and that transition that we're expecting to be coming hopefully sooner rather than later?
Late spring and summer months will be about right in terms of description around this. Councilmember Friesen, we have been talking about this with our teams, starting with some of the work on children's, service issues, and we've already begun to do some work around that. What the expansion looks like and what the need is still a work in progress, and we are early days in the discussions. I expect that they will move apace, especially as we go through some of the work around school-based mental health and partnering with MCPS, and as we expand mobile crisis, we're kind of folding those conversations together as best we can. But my sense of this is that we have to have a plan that is not just something that's in place by summer, but that is rolling out by summer. But I expect that, especially as we get into the fall of the year, when schools reopen and we start seeing children showing up in schools and a large scale reopening of things, that's when we're going to see the need for some behavioral health support in the community and in our workforce as well. I think this is also going to hit us in the workforce. So we're talking about it and rolling out strategies as we speak. It'll take some time to sort of really flesh that out.
Appreciate that. I think, that is the most appropriate, besides business relief and resident relief programs that we're going to have to continue to put in place with the federal money, the contracting of personnel so we can keep doing the public health response and then ramp up to the other efforts, that one-time expense for, those additional personnel that we're going to need for this unprecedented moment is the most appropriate use of that federal money. So look forward to seeing your thoughts on that plan sooner rather than later. Thank you. Appreciate it, Mr. President.
Thank you. Councilmember Glass.
Thank you, Mr. President. Good morning, everybody. Thank you for these updates. And, resetting the conversation, right? We see what the governor has been doing and continues to do. And I just want to remind everybody that it was President Biden who pledged that vaccine eligibility would expand to every adult by May 1st. And so I am pleased that Governor Hogan has committed the state to meeting that goal and doing so by April 27th. And so that is all good news for everybody. But to meet that goal, we still have more work to do. And, I continue to be disturbed by the types of conversations that are being had and, quite frankly, not being had. And so if I understand what I just heard correctly, yesterday at 1:30 in the afternoon, we got word that every vaccine provider needs to follow the state's eligibility framework. But we had no time to prepare. We had no time to update our website, and we had no time to communicate that with our residents. And today the governor has another press conference at 2:30, and we have absolutely no idea what he's going to say, which is par for the course. And so I just want to ask, quite frankly, to all the doctors who were here, these types of communications, when we are given orders with little notice, no notice, what does it mean on the back end? What snapping of fingers do we all have to do here in the county within the Department of Health and Human Services to prepare for these types of undertakings? And Dr. Stoddard too, for Homeland Security.
So it's I'll let Dr. Gale speak to the issue around the vaccination piece of this, but I will say around the communications piece, the communications are so broad and diverse in this county that every time we make a change, it's got to get communicated to you all, to council members, to our community partners, to the public, to the media. Web pages have to change. So it sends a vibration through the whole system of having to write and rewrite and things that are produced for us, and get them out to community members and to our community partners who share the word. And there are always still questions. People don't hear it the first couple of times you say it. And that's been true in every meeting that I've been in for this full year. You say it, and then the question comes back, well, can you tell us about this? And so we're repeating ourselves, which means we're now back in the public and having to take time to do that for every major change that we have. And clarify the confusion that exists around that. So it does send ripples, and it requires hours of additional work. The team, as quickly as we can, because as soon as the message comes out and gets public, the questions start flowing in from every corner about, well, what does this mean for us?
I don't know.
The other,
yeah,
I don't know if Dr. Gales, the other side is translation. We obviously have to translate everything, and that isn't an instantaneous process to make it flawless. And the other side of it is that, as Dr. Gales alluded to, the change wasn't explained, which means we're left in a position of explaining a change that we weren't making of our own volition, right? So, obviously we have to sort of, explain to our residents why are you changing this prioritization at the 11th hour, essentially, for some of these groups. And we're left saying, well, the state it looks like we're just pointing fingers at the state, but if we're not given an explanation for what the rationale for the change is, it makes it very hard for us to explain what the rationale for the change is, other than saying the state told us we had to do it, so we did it. And I hate to say it, but we've kind of gotten used to not getting information, which again, you should never get used to that kind of thing. But it's now a surprise when we get any sort of information or intel, as opposed to an expectation. And it's sort of an unfortunate thing with the way the relationship is right now. And we try and make it work to the extent that we can. Like, again, we don't know what's going to be said at 2:30 today, but we're preparing, like, it's sort of like a choose your own adventure. We have like alternate pathways that we can go depending on what the governor says or doesn't say. And so it's more work because we have to think about, do like scenario-based planning for a press announcement, which is, it's something you should have information about, and it's unfortunate.
And I think that to add to what my colleagues have already said, is it speaks to missed opportunities to actually plan and work together to develop strategies. Because if there are conversations and opportunities to workshop ideas before they're announced, it not only creates the opportunity to have more seamless, robust communication strategies, so that the expectation is, because we get lots of texts and calls as something is announced, and then there's a flurry of emails. How are we going to say this, and we're going to do it, and everyone's got expectations. And unfortunately, in a lot of those situations, I personally have to say, stop, let me find out more information as to what happened, so that can inform what is said, so that wrong information is not put out there. But again, it just speaks to their missed opportunities where there are multiple people who could be in the room to be a part of those conversations, so that when they are announced, all of the different potential implications of those strategies have been thought through, they've been vetted, they've been looked at from the state level as well as the local level. And it would give us more time on the local level to not only be able to message it better to our constituents, but to also be able to step up and have a lot of the plans we already are working on and looking to implement, to be able to, integrate those into the larger discussion. Again, we're excited to potentially, as we discussed, to be able to offer the vaccine to more people. But yeah, we unfortunately have become used to this circle of communication.
Well, I appreciate the candor, because as you alluded, all of us are getting communication and questions from our constituents in real time whenever an announcement is made. And none of us on this Zoom, no one in county government is given a heads up. And it's really important for our residents to understand that we want to be able to provide answers and insight in real time, but the lack of communication leads to missed opportunities, as has been said. And so, I'm going to throw it out there, as all of us have over the last many months. Governor Hogan, help us, help you to help vaccinate all of our residents. Let's do this collaboratively, and please give us updates and give us heads up so that we can update our website, get our communication channel in line, and allow all of us to be prepared, so that when our constituents, our shared constituents, express concern, that we can provide them with some clear guidance and answers. And so just because this has been the way it's been done over the last number of months, and quite frankly, over the last year, doesn't mean it needs to continue being that way. So I look forward to hitting reset on this relationship, so that we can all do the right thing and get more people vaccinated. So thank you very much for that insight and lifting the veil as to how decisions in Annapolis affect us here in Montgomery County. Thank you, Mr. President.
Thank you. No, great question, Councilmember, and great answers from all of you. I wrote some of this down, that it's a surprise when we get information or intel not in expectation, and what a missed opportunity we have to collaborate and workshop some of these ideas. It's very, very frustrating. And, you know, hopefully if any media are watching us, there hasn't been enough of this. I hope they'll ask the governor at 2:30 why he allows this lack of communication from his employee, our health officer, and our top health officials in the middle of a pandemic. You wouldn't run a corporation this way. You wouldn't run a government agency this way. It's crazy that we're running a state this way in the middle of a pandemic, but we continue to one year into the pandemic. Councilmember Friedson. I'm sorry, Councilmember Glass.
You already did.
Councilmember Navarro. I got to catch up here.
Thank you very much. Yeah, I mean, I think that, you know, if anybody had just tuned in for the very first time in terms of this conversation, let's just say hypothetically, it just continues to be an illogical exchange, given the fact that this is the largest jurisdiction in the state. And of course, we are still dealing with the public health crises of unprecedented proportions. And so, you know, I sit here trying to understand, because all along, my particular interest has been, how do we best address such an extraordinary challenge in the most strategic way? And time after time, you know, week after week, here we are basically struggling with the same exact challenge. And I'm at odds. I mean, there are, of course, particular theories out there, but perhaps I'm just too hopeful. I just refuse to believe that this is simply a political issue. It doesn't make sense, because we're talking about people's lives. We are talking about a county of over 1 million people, with an extraordinary diverse community, and a huge contributor to the state's economy and quality of life as well. And so I'm just constantly just blown away by the disconnect that continues to play out. And I guess, you know, we will have to once again figure this situation out, that we did not have any previous, you know, sort of heads up, no notification whatsoever. We'll have to figure it out like we always do. But I think, again, our constituents, you know, they don't want to hear about all of these frustrations. They want to know, how come at this particular moment in time, given this framework, why is it that the state leadership continues to not communicate with the leadership in the county, and makes it so difficult for us to literally do something so basic and important as now rolling out a vaccine to vulnerable residents and then to everyone, so that we can get to a point in the state where we can hopefully begin to turn the page on this pandemic. I just don't understand. So having said that, I was wondering if we have been able to establish some clear lines of communication with our federal representatives vis-a-vis now that, you know, things begin to open up more. The President Biden has made his announcement, et cetera. I know I've asked this question before. Do we have any particular direct line of communication to see whether our federal partners can then help jurisdictions like ours, given this experience, advocate so that we can get allotments directly allocated to us, given that we know best our communities? We're on the ground. We have these extraordinary partners who are working right now on the ground, who are literally faced with the need that exists and the frustration that exists, that you can't respond to it. So that's my first question. Have we established a clear line of communications with our federal reps to understand how they can best advocate for that kind of approach?
It's not there for Dr. Kroll. I don't know if he has any comments, but we have been talking to our federal delegation to a degree. Yeah, I mean, The information they're sending along to the state is that we're going to see this large increase around the 27th, so next week. I also know functionally we've heard through FEMA that they're going to begin to require vaccine equity in their reimbursement process, which will in turn drive people to do it indirectly, because if they want the FEMA reimbursement, they'll be required to share their vaccine equity plans associated with the distribution of these doses. That said, public health system is largely a state-driven system, and so the levers of the federal government to make states do certain things and and then in turn allow counties to do certain things are not 100% as flexible as I'm sure the federal government would like in some cases. But we've clearly heard the message around the goal of the president to get more doses out. We're seeing functionally in FEMA and other places that they're starting to push this equity issue further administratively, which has the impact of seeing it substantially and substantively on the ground. And so we are working through our federal delegation. I just don't know how much latitude they have constitutionally to sort of work around some of the states who may not want who want to have their autonomy too. And so I think that's what's sort of there's a few things at play here. And our hope is just that President Biden comes through with this commitment of increased doses, and more doses makes everything easier. When you're making scarce resource allocation decisions or that have to be equitable, it's hard, and we're doing it, but it's hard, and it gets substantially easier to make those equity-based decisions and to make them and address them more quickly when there's a lot more doses. And so I think the governor has made this announcement because he believes the federal government is going to come through with more doses, and we believe this administration is going to as well. We just, we really need to come, because otherwise we've created some massive expectations that we won't be able to meet.
Thank you. And I keep asking that because, I listened very attentively to President Biden's press conference when he first announced the commitment. And he did mention that one of the things that we're looking at was the sort of distribution directly to local jurisdictions. So I would like for us to track that. Now, secondly, in terms of this whole equity issue, and as it was stated by my colleague, Councilmember Joando, we were working around the clock this weekend trying to figure out what was the best way forward to target whatever limited amounts we had. But now, given this, unprecedented announcement, things go back to square one. And I've heard Councilmember Albornoz, request a session for us to review this. It's something that I'm really interested in, especially because of this conversation about the impending increase in the amount of vaccines. Yes, we're very fortunate to already have partners that are starting to do this work out in the community, but I think this is our time to absolutely enhance and expand our infrastructure, our logistics, especially in the hardest hit zip codes. And so when we get back to that conversation, that item that our Councilmember Albornoz requested, I would like to get some details on what that enhancement and that expansion looks like. How do we believe, what are some of the opportunities and barriers? Again, with the money coming in from the federal government, it gives us that opportunity to definitely, be ready and hopefully then, see some progress there. So I would like to request that specifically. And then also, obviously, the whole communication process and strategy that, now we have to pivot once again to address. Lastly, just of course, as we do all the time, as soon as there are some specific, sort of bullet points, talking points that we can all disseminate. I know it's been, a very short period of time. It would be super helpful so that we can let folks know exactly what this latest announcement means and whatever is going to be announced this afternoon. And again, I thank every one of you for continuing to do extraordinary things for our residents.
Thank you, Councilmember. If I could just follow up, I know on the equity plan and the ability, the outreach strategy that we're employing. I know, Dr. Kroll, I suggested a few weeks ago that we at some point begin door-to-door outreach in some of the hardest hit zip codes with culturally competent, multilingual canvassers with tablets. At the time, I remember you thought the risk of community transmission was probably too high. Are we at the point now where we could begin that, or do you anticipate we would be in the coming weeks?
So as it turns out, the Council President Hooker, the census outreach teams have already moved into that phase and have been doing some door-to-door outreach. They did, just by way of example, a mass pre-registration event at one of the community in Rockville a few weeks ago, and did door tags on 1,000 doors of people. But they have been reaching and talking to people. I don't know that they have yet been equipped with tablets, et cetera, to do that on-site pre-registration process, but they do have that capacity, and they've all been trained in how to do that. So it's a matter of doing it on cell phones if necessary, or walking people through that. So they are outreaching to folks, and they are masked and appropriately protected for this moment. And we have talked about where it's necessary, where they're going to be in regular close contact with someone for an extended period, getting them in the queue for vaccination as well. So those are ongoing conversations. They're doing that. They are scheduling town halls and doing group meetings wherever they can and wherever is necessary, as well as doing materials in languages. And we're working with them to identify providers, partners in the community who can not only pre-register folks, but when it's time, can actually schedule them. So as we discussed some weeks ago, so that we can eliminate some of that digital divide that's still a chief obstacle to getting folks into our system.
Right. Thank you for that. I'm really glad we've been talking about it for a while. I'm glad to hear it's beginning, and I know we'll get into greater detail at the briefing on the equity plan. And then just to follow up on the question about the conversations with our federal delegation, there have been some. I agree there probably needs to be more on this topic. I would add, I was at least in touch with Congressman Raskin's office when he was preparing the letter with Congressman Trone to ask for the mass vaccination site that also went into the continual shortchanging of Montgomery County in terms of the number of vaccines that we were getting. We also, the Council Vice President and I had a meeting with Senator Cardin's Chief of Staff that went into quite a bit of this, as well as the American Rescue Plan and the infrastructure bill. And then we also were in a meeting with the Chiefs of Staff of our entire congressional delegation. And I think now that their recent announcements from the White House have given us more indication of their direction, we should follow up on some of those items. But we've had a number of very productive conversations. Councilmember, go ahead.
Before you, just wanted to say that one of the things that we now have to do in the county and in the department, I think, is begin to pivot some attention to the recovery issues. We are talking about equity and vaccination, and we are still in the throes of that and have to stay focused on that as well. But the funding that is coming down for the Recovery Act now and Rescue Act is across a wide swath of need. And we need to once again turn attention to equity in the distribution and allocation of those resources as well. And this is a poverty index and looking at down to census tract level in the way we've done around vaccination, where the need is greatest, and figuring out how we manage to make sure that folks who have gotten funding before, gotten resources before, can continue and once again get resources, but also people who have not gotten, who are now hitting hardships that the first round of funding didn't cover, can get addressed and supported.
Thank you. Councilmember Rice.
Thank you very much, Mr. President. And I find myself incredibly frustrated. My first question is for Dr. Gales. Dr. Gales, what is your understanding as your role in this pandemic? You've stated numerous times that you haven't been consulted nor advised or apprised of anything that's happening at the state level when it comes to making these decisions. So what is your job? I mean, are you just there just to kind of do the governor's bidding? Is that what your role is supposed to be?
Thank you, Councilmember Rice, for the question, and hope I can answer it. The COMAR regulations lay out very clearly what the role of the health officer should be doing and what we are tasked with. And ultimately, that's to keep the residents of our respective jurisdictions safe, providing expert guidance around those particular issues. managing all aspects of the public health response, from clinical opportunities to surveillance and epidemiology and other support services, part of the public health enterprise. And in a pandemic, those responsibilities are heightened in terms of being able to provide guidance to multiple other individuals and bodies, such as the county council, as board of health, the county executive, and also working very closely with my peer colleagues throughout the state, the other 23 health officers, to provide guidance to the Department of Health, and ultimately, hopefully, provide guidance to the governor's office in terms of how these decisions are made. It is our hope and expectation that we also, in providing that guidance to MDH, is that they would have a seat at the table, and certainly be an influential advisor to the governor and his staff in terms of making those public health related decisions. There have been a few instances where we have been workshopped ideas, for example, to ask our opinion, but more often than not, we do unfortunately find out the new directives coming from the governor's office when the general public does in the setting of a press conference or a press briefing.
So I wrote down expert guidance, manage pandemic, be able to give the council appropriate guidance. I'm not sure how you can do any of those things if you're not at the table all the time. This isn't just one where you pick and choose which one you feel like sharing information about and you feel like collaborating with. This is a pandemic. This requires us to be all hands on deck all the time, always connected. And it's incredible to me, incredible that there would be an elected official. If we were to do this, if we were to say, you know what, we're not going to listen to Dr. Gales or Dr. Stoddard or Dr. Bridgers or Dr. Kroll the majority of the time. We're just going to pick and choose every now and then. What would our constituency say? What would the same constituency who has the governor as a representative say about us if we were to say, you know what, Dr. Gales, we're not going to talk to you about some of this stuff where we just want to do our own thing. I recall back to our most recent discussion about sports, and I know that my staff worked hand in hand with you. Councilmember Reamer's staff worked hand in hand with you to develop these regulations, understanding that you weren't supportive of all the things that we were going to move forward with. But we still knew that we had to, because it was the right thing to do for the safety of our residents as a whole. This governor has not done that at all. And it's a dereliction of duty, I believe. It is something where I hope folks remember this. Remember the fact that there are Black and brown people that are dying. There are Black and brown people that are getting affected by this disease more than anyone else. And you can hold a press conference, Governor Hogan, all you want to, and talk about equity. Where's the damn plan? Because I haven't seen it. Dr. Gales, have you seen an equity plan from the state in terms of ensuring that its most vulnerable residents will be protected when it comes to the dissemination of the vaccine?
No, there's, as best I can tell, there's no formal plan. There are different actions that have come out, with different efforts. But as far as an actual written comprehensive plan, no.
So Governor Hogan, you talk about where's the damn mask? I ask you, where's the damn plan? Thank you, Mr. President.
Thank you, Councilmember Katz.
Thank you very much, Mr. President, and thank you to all of my colleagues, especially the Councilmember Rice for his thoughts just now. Could we be clear on Montgomery County Public Schools and the Board of Health, how that interrelates? If the Board of Health says, yes, Montgomery County Public Schools, you can do something, but then it's up to the Montgomery County Public Schools whether they do it. We don't dictate it. Am I correct on clearing that?
Not a lawyer, but my understanding is you all would set the limits as the Board of Health, but they would have choice within those limits how to operate.
And my point being on the earlier discussion about the 3 feet versus 6 feet or whatever the Montgomery County Public Schools would decide is appropriate for them, they couldn't go less than 6 feet. I mean, they couldn't go more. I guess they could go more than 6 feet, but it would be up to them as to how they as to how they handled it. They couldn't be less than 3 feet at this point. And someone has contacted me, and I'm not 100% sure on how to answer this, but if someone has received both shots of either the Pfizer or the Moderna, do they still need to every now and then go and be tested? How does that work?
So if receiving both shots, 2 weeks after the second dose gets you to your maximum level of protection, the 95% that we've talked about before. But you can still be a carrier of COVID-19. You're highly less likely to exhibit any symptoms if you were to catch it and become positive, but you can still be a carrier. What I would say is, if you are concerned about an exposure to someone else that has tested positive or had concerning symptoms, you should definitely get tested. And if you are going to be around family members or others that particularly are vulnerable and either have not been vaccinated or, have tenuous physical situations, that it would be a good idea to get tested to know your status, to prevent, potentially transmitting it to someone else, even if you yourself may have mild to no symptoms if you were to contract it.
Thank you. I appreciate
Another piece to that, council member, is that the CDC has opined that if you are fully vaccinated, as in 2 weeks post second dose, or Johnson & Johnson 2 weeks post single dose, you are exposed to someone that does have COVID, you are not required to quarantine unless you develop symptoms, at which point you isolate and get tested. And so there are some, CDC's webpage does do a very good job of explaining sort of what the cans and can'ts do, and I would encourage anyone who's been vaccinated to review those, just to make sure that they understand exactly what they should do. I mean, there's, in terms of quote unquote required, what they should do. CDC does a very good job of laying it out.
Thank you. And it's already been touched on, and we thank you for the information about the door-to-door vaccinations and outreach. But I do think that the more we can let our people who are homebound know, and of course it becomes very difficult to let them know, because in some cases they're not paying as much attention to the discussion as some others are. But I do think the more that we can let them know that we are here to help, and to have people help them become registered and whatnot, is obviously something that we need to continue to do. And it's been touched on about the resources for mental health and everything else associated with the crisis. If we need additional resources, we need to be doing additional resources. This is you handle a crisis in the way that a crisis needs to be handled. As to the whole idea about the direct receiving from the federal government, we have to keep in mind that if our population is around of Montgomery County is over 1 million people, 1.5 million, or whatever this census comes back and says, well, that means we're larger. Montgomery County is larger than about 7 or 8 different states. And and not to pick on my friends from South Dakota, but if South Dakota is receiving it directly, by population, it would make sense that the federal government would allow a place with a population larger than 7 or 8 states to receive it directly as well. So I think we need to keep that in mind. And then my final point is the confusion on this whole issue is dramatic. Not only do we have the confusion within the state of, this week the Montgomery County or whoever can do it the way that they would like to do it, or know that it's best to do it, but then next week it changes. And then of course we have the whole issue of Washington does things differently. The state of Virginia does, the Commonwealth of Virginia does things differently. I mean, so it gets so very confusing to the people who are trying to follow this. So I think that we need to continue to do the very best that we can, and we are. And I think we always, and I'm going to end it with this, I think we should always thank everyone involved, and especially the people on this call, but everyone involved for actually doing the hard work it takes to keep our public safe. In a lot of cases, people believe that this is done by magic, and it is not. It is done by hard work and dedicated work by the people actually doing the work. So thank you, Mr. President.
Thank you. Councilmember Reamer.
Thank you. I just wanted to expand on the comments Dr. Stoddard was making about the projection the projection of continued dosing and what it means. You know, at our current pace of about 5,500 Montgomery County residents getting vaccinated daily, I believe most of them outside the county, but you know, because that's where the doses are. You know, at that pace, by May 1st, we would be at 65% of the population that is eligible in the county having been vaccinated. I am skeptical that that can be done without the widest possible eligibility. And Dr. Crowell, you may not be on mute.
Okay. Just stepping away from the mic.
That's fine. And I believe that's what the intent here is to open the doors widely in order to continue to be able to administer those doses. It may be difficult to achieve 65% of the eligible population having been vaccinated, you know, without having very, very wide eligibility, just because there are limits to human behavior. And so, you know, I think that is what's underlying the governor's pace and opening up eligibility very broadly now. And of course, it does not prohibit our equity strategy. In fact, I think it could help our equity strategy, but I recognize it's a different policy strategy. I think that's the distinction here, is that, you know, one path is to have a policy strategy, another is a more administrative strategy. But I think at the policy level, the issue is that we're vaccinating people at such a clip that if the eligibility is not more widely open, then there's a big risk that doses would go unadministered. And I presume that's what the governor's, you know, seeking to ensure doesn't happen. I don't know. I mean, I wish we did know. I mean, if Dr. Gales wants to comment on that, but in any event, I think that it's generally very good news that eligibility is opening up. It confirms confidence in the continued manufacturing of the vaccinations and the continued supply from the federal to the state. And I think that in all likelihood, the number of county residents who will get vaccinated is going to increase daily from where we're at now. You know, 5,500, 2 weeks from now, it could be 7,000. Who knows? I don't know. Nobody knows. Well, somebody knows. But I also think that won't happen unless more doses are available here in the county, at our hospitals, at our pharmacies, through our county clinics, with mobile clinics, you know, with visiting homebound seniors, with, you know, going into communities where people are less connected, you know, are less cognizant of procedures and rules that they may have to go through, aren't as able to make an appointment, you know, online, all those barriers. And the only way we're going to reach that kind of goal by the end of April of having 65% of the, you know, eligible population vaccinated would be with, I think, a Herculean administrative effort. So, you know, I think we should be concerned about our ability to make that happen, and just ensure that we have the partnerships in place and the plans in place and so forth. But, you know, we are able to continue with our equity strategy, acknowledging it's a different approach than one that is focused on eligibility. It's just focused on appointments and how we invite people in for appointments. Anything else you want to say, Dr. Gales or Dr. Stoddard?
Yeah, I was just going to say, I think we largely agree that eligibility should, broaden as we get more vaccine. I think the challenge that we had is the concern we really saw is back in when the phase 1B, 1C announcements were made. They were a week apart. And you had a lot of people in 1B who felt like because they could see 1C coming and they're like, well, I haven't got my vaccine yet. What does that mean for me? It's a messaging concern as much as it is anything else, where you create this expectation of availability when you give people eligibility. And whether, just the same as going to 0% restrictions sends the message that we're open for business, COVID's over, even though it's not. And we have these other sort of counter messages that we have to do distancing and masking. It's got, it is counter to the overall message when you say we're moving through these eligibility factors so quickly. We estimate that between the age of 16 and 64, those underlying health conditions is somewhere between 135 and 150,000 Montgomery County residents. That is 135 to 150,000 people who will need to be vaccinated over essentially a 2-week period before we move into the next tier of broadening eligibility. And so obviously, absent knowing the doses are here and are coming, it's very concerning to have set an expectation between the 13th and the 27th for that fairly large, substantial group of people. And oh, by the way, I'm not sure everyone's going to be as ethical as to say, I don't have an underlying health condition and therefore I'm not going to attest to it. So it's probably going to be more people showing up with a claim of a medical condition that requires them to be vaccinated. And so I think it's just as we were concerned when the governor went and announced 1B and 1C at the same time, we would rather say, I think there's no problem with being aggressive about the next phase, but pre-announcing something that's 4 weeks away on the supposition that we're going to receive more doses,
But
got us in trouble last time.
Right. I agree that the state may have moved too quickly from 1B to 1C. But now I think we have to have plans in place to reach deeper into the population and people who are not necessarily, waiting around all day long to get an appointment. And that's where we're going to be in 3 weeks if we keep up this pace, in a month. I don't think there's any question about the continued federal production of procurement of these doses. That's really not been in any dispute, as a high degree of.
What has been, though, is that they have promised the surge was supposed to have come 2 weeks ago, and they've pushed it back till the end of March. And I think I very much believe that this administration is working very hard to expand. It's just I have concerns that we're sitting here at April 15th, not having seen this significant surge, knowing that we've got our full adult population coming in less than 2 weeks at that point. And so it's just we've tended to want to be more cautious and expand as we have vaccine available to do it. But that's why we have a pre-registration list, because we can expand overnight essentially and add new people into the pool, as opposed to setting an arbitrary date and having that be the driver for when, I think we've always said, like, when we can't be equitable, we move on to the next group. I guess, with eligibility, all you do is those free-for-all appointments at our pharmacies will be taken up by healthy adult residents and not by people with underlying health conditions. That's functionally what you will see at those timelines.
Councilmember Reamer, I think that just to clarify something, I think I heard Dr. Stoddard say, we have moved from one group to the next group as we have vaccinated primarily in that preceding group. So we've managed that through our pre-registration process and opened up to the next group. But the thing that I think I hear you, one of the things implied in what you're saying, I think, is that there's a need for capacity, the ability to push those doses out as they come up here. And that's a piece that we are working on now with our providers and with expanding our provider relationship so that we have doses as far as the county is concerned. Two thoughts about that. One of them is that it won't ever be the county health office's department or the health department's responsibility to manage all of that expanded capacity. The states, the pharmacies, the mass vaccination sites all have to play a role in that. And the second one is that it has been utterly unpredictable about well, virtually unpredictable, the number of doses we're going to get from week to week and when we're going to get something versus when we're not going to get something. I live with the expectation that at some point we're going to go from, you know, our 8,800 doses a week to 25,000 doses a week or some ridiculous number like that. And I want to set some expectation for this, folks. We will not be able to keep up with that initially. It will take some time to get a response, to get ourselves into class, no matter how many people we provide. Getting those doses out, providers we have, getting those doses out is going to take some time. And there will be doses that we will be getting out as fast as we can. But I think it's important for folks to know that because it's unpredictable, no matter how we expand it out, it's an unknown. I don't know what the federal government is going to do. I don't know what the state's distribution plan is going to look like. And until we know that, and even once we know that, given how we learn about it, you know, tomorrow's press conference, the ability to react quickly to that is always challenging. Right now, we've been able to manage that and react quickly to it because the doses that have been dropped in on us have been manageable through us and through our partners. I think that's going to change at some point. I'm hopeful that will change, in fact.
Thank you. I think Joe Biden has set May 1st as the date for all adults to be eligible, because at that point, if we don't have such wide eligibility, our administration rate could slow down. That's my interpretation of the rationale there. So they want to set the framework for the states and the localities to plan that they've worked out the supply from the manufacturers, and it is of sufficient volume that if we're going to get these into arms along the timeline that the Biden administration wants us to, we're going to have to be at all adults eligible and have the doors open that wide, you know, by May 1st.
I hope that the implication of that, of opening the doors wide, is that there are doses following. That's, of course, you know, not been our experience with the state opening up eligibility, and doses not necessarily lagging.
Not yet. It has not been that way yet.
I'm hoping that President Biden that you're right about that interpretation.
Thank you.
Thank you. I don't see any other requests to speak. Let me echo what everybody said to thank you so much for all your hard work under very difficult circumstances, and we'll continue to hope for a more collaborative approach from the state and better communication from the governor starting today, hopefully.